No. All right, we're going to shift gears a little bit. I know we touched, one spectrum that is like lentigo malignant melanoma in situ. They don't have invasive disease. Let's go on the other end, that metastatic melanomas, and distant mets. And how is the radiation being applied in that setting?
For patients with melanoma that have distant metastases, generally speaking, radiation has been used as a palliative maneuver. That is, a treatment that can help alleviate symptoms that are caused by metastases. So, for example, a tumor that is bleeding, radiation therapy can potentially alleviate bleeding. Or if the tumor is causing obstruction of an airway, causing difficulty with breathing, radiation therapy can be used to alleviate that obstruction and relieve some of the difficulty with breathing. So that's historically how radiation therapy has been used for patients with metastatic melanoma. I emphasize historically because there is an evolution, that's undergoing, that's happening right now. And that is, whether or not radiation helps in patients that have limited numbers of metastases. As you know, surgery can be used in people that have metastatic melanoma and limited numbers of metastases. And in some situations can lead to, very good long-term outcomes. And so the application of radiation therapy in a similar manner has also been something that some have been exploring. And this has really been facilitated by advances in the technology. That is, our ability to more precisely deliver high doses of ablative radiation in a safe manner, which has only become possible in recent years based on technological advances.
What kind of modality are you using to target so precisely?
So one thing that's been a big advance is the development of a technique called stereotactic body radiation therapy. And that refers to be able to deliver a very high dose, precisely targeted radiation treatment, which is guided by imaging. That is, before the radiation's being given, really be able to see and make sure that, the metastasis is right where we think it is, and then delivering that high dose of radiation therapy to it. In the last few years, there have been some reports of this in melanoma that look favorable. That make it seem as though metastases can be durably well controlled using these techniques, and that for some people this leads to longer term control of their melanoma.
So, all right.